Shalom and welcome to 2 Minutes of Torah. This year is entitled, I have one respirator and two dying patients. Who does it go to? How tragedy that this is halacha l'maaseh, this question nowadays. The coronavirus having a rampage around the world, and so many hospitals are short of respirators, and you have people with corona in horrible shape, desperately in need for a respirator. It's a real case now. We have a few patients in serious critical condition and one respirator. Mainei Yeshua already announced that they do not have equipment enough to service all the people. This is a serious, tragic shaila. A few words of introduction. It's Hashem next year. We'll try to see halacha l'maaseh. A few words of introduction. It is absolutely crucial. Anything we discuss here in this 2 minutes of Torah is not halacha l'maaseh. These are serious questions that need to go to major poskim, and thank God, hospitals work. Many hospitals work with rabbis, work with the poskim. That's how it has to be. One of the greatest giants of the last 50 years. It's Tzitz Eliezer. There's a Waldenberg, giant in Kol Torah Kul and medical law. He used the posik for Shari Tzedek. This needs to be treated with unbelievable care, with halachic respect for giants. So this is not the venue to for halacha l'maaseh, just to get an overview of the topic. That's number one. Number two, it's absolutely crucial that we are guided by halacha here. Certain areas, a person knows, I'm not well trained in this area. I don't know what the halacha says. Person finds out about certain clothing and is asked about, is this garment shatnez or not? I don't know anything about shatnez. I didn't really learn about shatnez. I don't know the industry. I don't know the facts. I don't know what to say. Another question, can I go ahead? Let's see, Daf Yomi, I was talking about cooking, shehiyah, electric flake. Can I go ahead and leave a soup on an electric flake before Shabbat? Can I go ahead and return a soup for the fridge on electric flake? If you didn't learn Hilchot Shabbat, there's nothing to talk about. You have to just humbly say, I don't know. I didn't learn the topic. Over here, it's a little tricky because here people could think, well, listen, this one's 98 and this one is 20. And the 98-year-old is sick and not well to begin with and already has a history of many illnesses and in addition has corona. And the 20-year-old is all of life ahead of him. These arguments are not necessarily anchored in halacha. We have to be so careful that we approach this sugya like any sugya with the right halachic approach. We need to explore the sugya. And we need to see, does the topic take into account the viability of each patient? The lifespan, the potential lifespan of each patient. Maybe it does, maybe not. Let's look into it. But here's an area where one might have an ethical intuition, and that has to be put aside. And there's many halachot like that, where a person feels they have a certain understanding of the topic. And it's very important to just push that aside and let's explore the topic. Yes, we want to know about viability, and we want to talk to doctors about all the information here in terms of gathering information. But that's only insofar as we're looking through the halachic lens of what information is crucial for us to make a decision. And maybe viability is crucial, maybe not. And if viability is crucial, then we need to talk to the doctors and find out. We always partner with doctors and the experts. What's considered to be dangerous or not during the coronavirus? A public gathering is inherently dangerous, not inherently dangerous, or it's theoretically it could be done in a proper way, but then people won't distance themselves properly. So, of course, halacha is going to work together with the experts. But it's crucial that we have our bearings anchored in Amasorah, in halacha, and then we take all the information and filter it through the halachic lens. It's Hashem next year we'll look through some of the details in the halacha, what halacha has to say about this most delicate and sensitive of topics. Shalom.